Good morning, Mr. Harris. I'm Dr. Emily Lawson. Thank you for coming in today. Please have a seat. I understand your family has been concerned about your drinking habits, and they suggested you come in. Is that right?
Hello, doctor. Yes, they are worried, but I told them I don't think I have a problem. I'm just here to make them happy.
I appreciate your honesty. It takes courage to come in, even if you're doing it for your family. To help me understand the situation better, could you tell me a little about your current drinking habits? For example, how often do you usually drink?
Almost every day, really. After work, I go to the pub with mates for a bit, then I usually drink alone at home. It helps me relax.
I see. And when you drink after work, roughly how many beers do you have in total, including at the pub and at home?
Probably about 10 or 15 beers in total usually.
Thank you for sharing those details. How has this amount of drinking been affecting your daily life and responsibilities? For example, your work or your home life?
Well, sometimes I'm a bit late for work, and my wife keeps nagging me because I don't feel like doing the chores she asks. But that's normal when you're tired.
Thank you for being so honest about the challenges. Just to make sure I've understood everything, you drink almost every day, totaling 10 to 15 beers. And you've noticed this is interfering with your work punctuality and your responsibilities at home. Is that right?
Yes, that's right.
Thank you. Now, based on what you've shared and the professional guidelines we use, I need to be honest with you. The amount you are drinking, especially combined with the interference it is causing to your work and family, suggests that you have what we call alcohol use disorder.
Wait a minute. Disorder? That's ridiculous. It's normal for a man to drink after work, and it's what I deserve after working so hard. I don't need a label.
I hear your frustration, and I understand why you feel angry. However, my role is to give you an accurate medical assessment. Let me tactfully explain why I have made this diagnosis. Your high daily intake and the fact that it is now affecting your responsibilities, being late for work and avoiding chores, show that your drinking is starting to control you, rather than the other way around. That is the definition of alcohol use disorder. Before we discuss a plan, I must warn you about one important thing. If you suddenly stop drinking completely, you might experience withdrawal symptoms. These include things like sweating, a rapid heartbeat, hand tremors, problems sleeping, nausea, vomiting, or sometimes agitation. Do you understand what to look out for?
I guess so. That sounds pretty unpleasant.
It can be, which is why we need a supportive plan. I strongly recommend that you consider attending a group therapy service. It's a place where you can confidentially discuss your drinking with people who are in a very similar situation. It can be incredibly helpful.
Group therapy? No way. I'm not going to sit around talking about my private life with strangers. I refuse.
I understand your hesitation about sharing personal matters, but your health is the most important thing right now. While medication can help, getting support and discussing strategies with others is vital for long-term recovery. This is not about blame. It's about getting the help you deserve. Please, for your family and for yourself, give it a try.
Fine. I'll go to one meeting, but don't expect me to like it.
Thank you. That is a very positive first step. Let me quickly summarize. We'll set up your first group session, and I want to see you back here next week to talk about reducing your intake safely. Do you have any final questions for me?
No, I'm good. Thank you.
You are very welcome. We will support you through this.